what allowed the introduction and great stage. You instantly feel the difference between the business event and the scientific conference. Today I'm talking on behalf of Laboratory of Biophotonics at the University of Latvia Institute of Atomic Physics, supervised by Professor Jānis Spīgulis. In our team, we have a wide range of researchers, both from fields of physics and biology, and also doctors. And I would like to go through and speak about some prototype devices which could be named as proof of concept devices. Each of them comes as a result of some research project, and there is also already a small portfolio of them. One particular focus of our team is skin malformations, and where dermatologists needs to know either these vascular signs are normal or they are potentially dangerous. And nowadays, dermatologists use visual assessment, and they pretty much use the microscope, and it's less or more a webcam. And in either way, they need to take biopsy, which is invasive and lead to scarring. And here we can come inside and offer these doctors, let's call it optical biopsy. There is an example where we combine cameras and specific light sources to create a camera-based device that is portable. It can be used at bedside near the patient, and it uses multiple LEDs as a light sources, and corresponding filters, and to obtain images from different wavelengths, and by using some sort of image processing algorithms, we can develop some parameters which are potentially diagnostically valuable, and doctor can distinguish between these vascular signs. There are a couple versions of such devices. Some of them has conventional RGB cameras. Some of them are more extended to near infrared region, but in either way, what they do, they obtain the images from different with different wavelengths and under different illumination, and by combining these images in a multispectral cube, it is possible to calculate these parameters and draw a mapping of these parameters. And in this way, we can combine visual assessment with this parameter mapping, spatial distribution map, and dermatologist can improve his diagnostic criteria. As you can see, in some cases, this parameter value is less than surrounding area, and sometimes it's larger, so this mapping shows already high potential to be used in clinical diagnostics. As said before, there are also some applications in detection of counterfeit money in different illumination and in different combination of images. Some particular marks appear or disappear, they are visible. And this spectral analysis of specimen of sample can also be potentially useful in different stages or in different end users. It can be incorporated in some smart devices or can be standalone device, but another way it can be used in real time. Another technique used for diagnostics of skin is called photoplatysmography imaging. Its purpose is to detect blood pulsations from video image, and here we use high frame video recording in order to get this video recording from the skin, and in this manner we can detect differences of blood pulsation in different regions of the skin. It is very useful in some clinical applications, for example in surgery where patient's arm is laid down near his bed, and with a pretty simple camera-based device we can detect either the perfusion is changing or not, and this corresponds to the success of anesthesia input. So if this anesthesia is successful, then after some couple minutes or between 10 or 15 minutes, this perfusion pattern changes significantly. Another application for both spectral and thermal imaging is Sepsis Diagnostics, where we have made a proof of concept prototype in order to go to intensive care unit and make optical examinations of septic patients. Recent time we also do examinations of COVID patients, and what we see is very interesting marks and vascular reactions in these patients, and these maps of oxygen saturation or thermal distribution can be also transferred into diagnostically valuable parameters. So the bottom line is that here in Latvia, in this university, in this group, we can make these proof of concept devices. In most cases, they are specifically made devices made from unspecific components, mostly machine vision. And where we are good, we can offer validation series both in laboratory and in hospitals of these devices. But I must say that the bottleneck is that where actually the business should start with the commercialization of these devices. This is a very same moment when our business as researchers is finished. So there is a gap between the transfer of knowledge between this research level and next stage of business level. Yes, thank you very much.